Welcome to our live webinar titled Coping with the Fear of Reoccurrence. Thank you for joining us. My name is Lee Clark, patient educator, and I will be moderating the presentation today. As we get started, I would like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the webinar program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your internet connection during the webinar. If you are unable to view the webinar online, you can call in to hear the audio portion of the program using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentation, there will be a question and answer session. Please feel free to submit questions at any time during the presentation. To submit a question or a comment, open the Q&A window in the lower part of your screen. Type your question in the small text box window, and when you are finished typing, just hit enter. We will do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help us manage the incoming questions. Submit your entire question all at the same time. And second, please do not share private health information in your question. Our speaker cannot answer any specific questions related to your health care. Today's specialist is Mary Hughes, who is a psychiatric clinical nurse specialist at the University of Texas MD Anderson Cancer Center. With that said, it's my pleasure to welcome Mary. Mary, thank you for joining us today.
Thank you. It's my pleasure. I'm very glad to be here and to speak to everyone tonight. And I hope everyone is well. So tonight we're talking about one of the most popular topics that patients want to hear, coping with the fear of recurrence. So my next slide will be up momentarily. Now, all of you that have cancer are going through cancer treatment. You see all the different ways in your life how it affects you. It affects your personal functioning, your sexual functioning, your physical, you have symptoms, your independence, all of those different things, it affects you. So all different areas of your life, personal life and your business life. Next slide. So Bertrand Russell said, fear is the main source of superstition and one of the main sources of cruelty. To conquer fear is the beginning of wisdom. So think about that. So next. So fear of cancer recurrence, it has its own little FCR. It's one of the most common and distressing issues. It causes fear, worry, and concern that cancer will return or progress, either in the same place or another body part. And as you know, all of you, it's very pervasive among cancer survivors. Next. So it's characterized, how do you know if you have this? You may be preoccupied with, oh no, I had this lump. What if that means cancer? Oh no, I'm not feeling good. I've been having night sweats. So you're preoccupied. Everything becomes cancer. So it makes you not cope well. Things that you might be interested in doing and enjoy, you don't do that because you're afraid it's going to make the cancer come back. It impairs your function. You're not able to do what you usually do because you think it's going to make you worse. It's hard to plan for the future, which right now all of us have difficulty planning for the future. And it's intrusive thoughts. You can't stop yourself from thinking about cancer. Next. So the greater your FCR is, the greater psychological distress you have because you can't enjoy yourself. You have more depressive symptoms, you're more anxious, and your quality of life is worse because this interferes with everything. Next. So it's higher Now listen, you know who you are. In younger people, in females, if you have a worse disease prognosis, it's worse. If you've always been worried about this hurting or that hurting, it's going to be worse. If you feel socially isolated, and unfortunately, we're all socially isolated now, lower education, and if you have more physical symptoms, say you have more side effects from your treatment, that's going to make your fear of cancer recurrence higher. Next. Fear. Next. So what is fear? It's an instinctive emotion. It makes you afraid of some expected evil. It causes suspicion. It causes doubt. And it's evolutionary. So our cave people, the forefathers and foremothers, were afraid of dinosaurs. Well, we don't even know what a dinosaur is now. But as it progressed, then they found about fire. They developed fire, and they became afraid of fire because it helped them, but it also protected them. Next. So Rudyard Kipling said, of all the liars in the world, sometimes the worst are our own fears. And think about it. Your fear is not based on a truth. Your fear is based on something that could happen, but has not happened. Next. So think about this. What is your biggest fear? And sometimes when I'm seeing people, and I see people individually for therapy, one of the things that they're afraid of might not have anything to do with cancer. It might have to do with somebody in their family who's sick and dying. But cancer does cause a lot of fears. So fear is an unpleasant agitation. You know, you feel agitated, you're not quite sure why. You think it's a perception of danger and makes you want to hide or escape. Lerner said, fear is an uninvited guest, right? Nobody sits and thinks, well, I'm going to be afraid right now. It just comes in and you think, oh, I don't want you here. But it also helps with self-preservation because you would not walk in the middle of the freeway. You're afraid you're going to get run over. You would not leave the house with the stove burning because the house might burn down. So it also protects you permanently. That's the permanent things that it protects you from. Fear also protects you until you can deal with the reality of the situation. Remember when you were first diagnosed with MDS or AA and you thought, oh, you couldn't even think, this isn't happening to me. This is somebody else. So that fear that you had for your life protected you until you could think about, okay, the treatments and the treatment plan. It can paralyze you. It also heightens the imagination. And those of you who are imaginative probably have a lot more fear than the kind of concrete person. Next. So, as if said, this is one of my favorite quotes. Fear is a dark room where negatives develop. So fear never ends up in anything positive, does it? You don't ever say, oh, I'm so afraid so-and-so might come and we'll have a good time. No, your fear is always about something negative. Next. So there may be a phobia. Now, if you have a phobia, that's an irrational fear. People that are afraid of heights are afraid of enclosed spaces. That's irrational. But it may be politically and culturally manipulated for persuasion. So, and you all have experienced this, unless you're 10 years old. Politically, we get manipulated and it causes fear. Culturally, the same thing. It can be motivational, like for athletics. The coaches put fear in the athletes' imagination. You know, if you don't do this, then you're going to get kicked off the team or whatever is going to happen. We're going to be beaten. So it's motivational. It's not all negative things. Next. So how do you know if you're afraid? For some people, they get very anxious. They're grouchy and irritable, angry. So people that are irritable, usually they don't recognize it. It's the family that recognizes it, right? There may be sadness and depression because brought on by fear. And think about this. You know, all of you know fatigue is very prevalent with cancer treatment and with your disease. Think how much energy it takes to fear, to be fearful and use that negative imagination. It may even cause physical illness. It may cause you to distance yourself from everybody else because you don't want to listen to them talk about my fingernails or my hair or anything like that. That's not important to you, and you don't want to be around that. Fear may also cause you to cry. You have a lot of crying. And so one of the things about crying is not always negative. Crying, when you cry, you feel a great sense of release. And I find it very interesting that when people cry, they apologize. When people laugh, they don't apologize. Laughter comes out of a feeling, so does crying. There may be a change in sleep pattern. Maybe you can't sleep because you're laying there worrying. Your heart may be racing. You may have muscle tension. People that have these headaches, tension headaches, that's a physical change that can come from fear. Shoulder pain, all those muscles get very tight. You may have GI symptoms. Sometimes people that are anxious have diarrhea, and they know what it's from. It's not what they ate, it's because they're fearful. They may have fever blisters like on their lips, and they know, oh, dang, I was so worried last week, and this is what happened. So it affects you physically also. Next. And so when do your fears increase? And all of you know this. If you have a suspicious symptom and you're thinking, oh, no, I bet my cancers are back or it's increased, or it's time for you to have a workup. It's time to get rescanned, time to have your blood test, and you're waiting. Isn't it horrible when you have your test on Friday and you have to wait till Monday to get the results? If there's a change in treatment modality, maybe you had chemotherapy and you're going to get radiation. So anytime, are you getting a different kind of chemotherapy? Your treatment's over. Uh-oh. Wonder if my cancer really is gone. Is it really in remission? Next. So Burke said, no passion so effectually robs the mind of all its powers of acting and reasoning as fear. It's hard to make decisions when you're fearful, right? And every one of you can tell me the day you were diagnosed with cancer. You might not be able to tell me your children's birthday or your spouse's birthday or anything, but you can tell me on July 5th, 2000, I was diagnosed with cancer. You also get more fearful when somebody else gets diagnosed with cancer, or somebody else has more cancer, or somebody, especially people that are in the news industry or movie stars, those kinds of things, when they die from it, because we often think, well, now, they had all the money in the world. They could get the best treatment anywhere and still they died. So that makes you even more fearful. Mark Twain said, this is very important, courage is resistance to fear, mastery of fear, not absence of fear. I'm sure you can remember a time in your life when you were supposed to do something, you were fearful about it, and you thought, okay, I'm just going to do it. And then you pushed through your fear and did it. You weren't courageous. You just knew what to do and you mastered your fear. Next. So coping. So you've heard this word thrown around, coping. Oh, how are you coping? Coping is a way to handle your stress. It's something you do overtly to handle it. And it's how you think internally. You try to change some of your thought processes or perceptions. Next. Also, it's anything you do to try to reduce demands of these stressful circumstances. So for some people, they may like to listen to music. Other people are very sleep a lot, but they know they're sleeping to escape their fear. But coping is temporary. As you know, adapting is how you change something for the long term. Next. So coping, what does coping depend on? The type of cancer you have, which stage it's in, what kind of treatment you have and the side effects of your treatments, what symptoms you have, how your disease, your MDS or AA, how it progresses, and what your prognosis is. But always remember about prognosis. When they say 50% of the people survive, well, 50%, when they say, well, you have a 10% chance of this working. Well, it had to work on 10%, right? Even though it didn't work on 90%, somebody had to be in the good end of that. So always remember that whenever you get a statistics that seems negative, focus on, well, they didn't say 100%, so some people did well on this. Next. So coping also depends on your prior level of adjustment. And that's why I think that people who are younger, have a greater fear of cancer recurrent, because they haven't had to go through that many things in their life that challenge them and that they had to adjust to. It depends on your personality. So I'm sure all of you know I have an Aunt Sally. Oh, sorry, I'm in the room with the clock. So every 15 minutes it will chime. So that Aunt Sally was always a nervous Nelly, right? And whatever happened, she would catastrophized about it. Oh no, this is horrible. It's never going to get better. So personalities like that have a difficult time coping. There are some personalities who they don't seem to kind of know what's going on with them. But you look around and there's always somebody in their family that knows what's going on and knows the information and feeds it to them as they need it. It also has to do with your prior experience with loss. You never get used to losing things in your life, losing your health, losing a loved one, a pet. You never get used to that, but you know that you can adjust and you can adapt and your life goes on after that loss. Next. So coping also depends on attitudes, cultural attitudes. In some cultures, they're very stoic, they don't cry, and they don't show emotion. Some that are more spiritual, if you have spiritual attitudes, people tell me that's what helps them to get through their cancer, is their spiritual belief system. Religions can be helpful, what religion they go to, but also religions can be negative. Unfortunately, there's some religions that tell people the reason they have cancer is because they don't believe enough. And you know better than that. If there are emotionally supportive people in your family, that also helps you cope. And if you know that there's a potential for rehabilitation, even though you get very weak after your chemotherapy, during the chemotherapy, you can take physical therapy, occupational therapy, and rehabilitate yourself. Next. So what do you have to do to cope? One of the first things is to integrate the diagnosis. You have to know you have cancer. So sometimes I see people shortly after their diagnosis and they still, it doesn't feel like I have cancer. I just can't believe I have cancer. So you have to believe that. Then you have to be able to tolerate the stress, right? And that stress is about the unknown. You have to adjust to the healthcare system. And I think that's one of the biggest things that people have to do, because you learn a whole new language. Who know what white blood cells? Who know what neutrophils were? Who know what neutropenic fever was? All this language that you learn, that's part of the healthcare system. That's part of your treatment. You have to make treatment decisions. And unfortunately, you don't have a lot of time to make those decisions when you're given the options and you're thinking, I don't know, I'm not a doctor or a nurse, I don't know about this stuff, but you've got to make the decisions. And one of the hardest things people tell me is to be able to tell their loved ones about their cancer. Often if they have young children, it's hard to tell them and how to tell them. I often see people who don't want to tell their aged parents because they don't think they're emotionally stable enough. I remind them, your mother's 80 years old. Look what she's gone through at 80 years. She will be able to tolerate this, knowing that there's a plan for the treatment. Next, please. So Zig Ziglar, think about this. This is really good. Fear has two meanings. Forget everything and run, or face everything and rise. The choice is yours. Next. So happiness, you try to find it where you can. It's not a destination. You remember when you were younger and you think, oh, if I just finish school, I'll be so happy. Or if I just get this job, I'll be so happy. But you found out it wasn't a destination. It's not getting there. It's a way of traveling, and it's a choice. So when you wake up in the morning, you have a choice. Am I going to be miserable today, or am I going to be happy? And you know, nobody can be happy all the time unless they're really highly drugged. Happiness comes in little spurts. And so you have a little spurt of happiness and yay, and then you go back to doing what you were doing, and then something happens, you see a flower, or somebody calls you and you're happy, and then you know you settle down to contentment. Next. So having cancer is a threat to attaining marriage. There's people you know probably that live together. That's the way of the world. And they thought at some point they would get married. But I've seen these people and they decide they're not going to get married because one person has cancer. They don't want to bring the debt of cancer into the marriage. Younger people who delayed pregnancy and thought, well, I'll get pregnant after I get my job. Well, now that they're getting treatment, they might not have a choice. Child rearing, it's very difficult, as you know, for mothers with young children and fathers with young children to raise their children. They have to have help. And I remind them, because mothers especially feel guilty because I can't do this with my children like other mothers. But for your children, you're their mother. They don't expect anything else from you because this is how you've been. Those of you who have jobs, it may be a threat to your getting a promotion. And I've seen people who thought they were going to retire, but they had to keep working so they could have their insurance. Next. So what do you do when you have this? One of the most important things is to get counseling. So you can talk to someone else who is not a loved one to learn how to cope with stress, because your stress is different from your loved one. You're both concerned about your health, but your loved one has a different perspective on it. Mindfulness activities. This is when you stay in the present. And people who are fearful have a great deal of difficulty staying in the present because everything is what if. What if this comes back? Well, I can't buy me a new car because what if my cancer comes back? I can't buy any new clothes because what if the cancer comes back? Mindfulness helps you focus on right now. Today, what you know is your cancer is being treated. Or if you're in remission, today what you know is you're in remission. Yeah, but what if my cancer comes back? Nope, that's not what you know. What you know is today. It's also difficult to manage uncertainty. So you focus on what you do know, like I don't have cancer, or my cancer is being treated, and have short-term goals. And it's also very important to effectively communicate with your healthcare provider. You know, when you're on a clinical trial especially, it's important to report your symptoms. And I know people who have difficulty because they think if they report their symptoms, then they'll take them off of treatment. And then what will happen? Well, it's important to report the symptoms because there's other things besides stopping the treatment. There could be dose adjustments. So it's important to communicate. And when you go, I see people and I'm asking them these different questions and I'll say, well, did you tell your doctor? No. Why not? He didn't ask. So there's sometimes you have to present. So try making a list of things you want to talk to your doctor about so that the 5 minutes you see the doctor, you could report the symptoms that you have. Next, please. So optimistic coping behaviors, humor, and I'm sure that many of you have found that your humor has changed. You laugh at things that other people don't think is real funny because it's dark humor. But this is where you find your humor. Distraction. So it's important, if you can, to find something to distract you. If you like music, Listen to music. Help that distract you. When you're real anxious, the music to listen to at first is lively music, and then change it to a little bit more serene music. Because if you're real anxious and you listen to real soft, serene music, it's totally opposite from how you feel. So listen to something that's lively. Mozart's very lively. And then, bring your music down a little bit until you're more relaxed. Social support, having groups to go to, that's very important. You can find out how other people helped with whatever problem they had. They can help you. Doing this can look like denial, but it's not denial. You know what you have, but you don't have to deal with it 24/7. Next, please. So when I said make short and long-term goals, some people want to be able to be well enough to go to a wedding in 6 months or go to a graduation in a year. Hopefully we'll have graduations then. But those are short-term. Long-term. Short-term goals is, I see many people that don't even get dressed every day because of COVID. So I help them make a short-term goal. You will get up, you will take a shower, and you will get clothes on. Because your body, and you do this for you, not anybody else, when you put on clothes for the day, then you're ready for the day. If you keep your gown or your pajamas on all day and all night, you don't know if it's day or night. So it makes you feel differently when you dress for the day. That's a short-term goal. Locate and find out what resources you have. Like this organization is a great resource. Look at your strengths and weakness. I bet most of you had no idea how strong you were. Before you got diagnosed, you thought, oh my goodness, if I ever get cancer, I don't know what I'll do. I just know I can't stand it. And here you are, going through or have gone through treatment. You didn't realize how strong you were. And always remember that you have a choice. Just because you're offered a treatment doesn't mean you have to take it. If you feel like you're too frail and that you need a break for your body to heal and get stronger so you can tolerate what comes along next, talk to a healthcare provider about that. Can I have a break? Can I just skip my next treatment and until I feel a little bit stronger? So the choice is very important to remember. Next, please. So I'm going to go to depression because it's very important, I think, for you to know what symptoms of depression are. In case you have them, you can ask for help. So this is depression in anybody, with or without cancer. People quit being interested in sex because when they're depressed, they're not interested in anything. But it's often underdiagnosed, and 25%, that's 25% of cancer survivors have depression. Next. So depression is not a, keep going, you're going backwards. Yeah, next one. So it's a slow onset. You just don't wake up one morning, I'm depressed, I think I need treatment. At least 2 weeks you need to have the symptoms. There may be crying, sadness, irritability. Either you're not sleeping or you have early morning awakening, 3 o'clock in the morning you wake up, you don't know why, or all you want to do is sleep. Next. You may notice also that you don't want to eat. You're not hungry. But sometimes with treatment, you're not hungry, right? Or unfortunately, women like to feed their emotions, so they may be eating a lot. You're withdrawn. You're not interested in anything. You don't return phone calls. People come to see you. You don't answer the door. Men may have erectile dysfunction, and we talked about sexual disinterest. The real red flag is you think about hurting yourself. So I ask people if somebody tells me, I don't think my life is worth living. So then I'll ask them, well, you're going through all this cancer treatment, and this is hard treatment that you're going through with the side effects. I think you want to live, otherwise you wouldn't be going through these treatment. It may be hard to focus and concentrate. You might not be able to read a book because you can't focus enough, but you can read magazines. You might not be able to watch a 2-hour movie because it's hard to keep everything sorted out, but you can watch a 30-minute sitcom. You feel worthless. Unfortunately, we think we are what we do. And if you can't work and produce like you used to, you feel worthless. Maybe it's hard for you to organize your thoughts and you just feel depressed. You don't care. You're hopeless. You don't look forward to anything and you're not enjoying anything. So sometimes I ask people, well, when you went out to eat with your wife, did you enjoy it? No, I just did it. So you may feel like you're watching yourself go through the motions of things that you're not enjoying. Next. So it's very important, if you have these symptoms, to report them, because there's treatment. It can be supportive psychotherapy. That's what I do. Or cognitive behavioral techniques also. Antidepressants can be helpful, but very important to remember, antidepressants can take up to 2 weeks or more to work. So meanwhile, you're seeing somebody and you're talking to them about your feelings and what you do with your feelings. The most successful treatment is a combination of antidepressants and some type of therapy. Next. So now, I'm sorry, my clock's gone off. Fear is only as deep as the mind allows. I thought that was profound. It's only as deep as the mind allows. So anxiety. So there's two main feelings that people have, depression and anxiety. Anxiety can happen just overnight. Often people that have anxiety that's bad enough to be seen were worriers. If you're a worrier, now that you have cancer, that gives you something to worry about, right? You may be feeling agitated, you're not concentrating, you're worried, you're not sleeping. Rumination, that's going over the same thing over and over and over. Ritualistic behavior. For instance, there's people I ask them, tell me about your closet. Are all your blouses together and all your pants together? Oh, yes, that's a ritualistic behavior. How often do you sweep your house? Some people every day, vacuum every day. Do you ever go back and check to make sure you put the garage door down or that you turn the stove off? So there's different type of rituals that people do. And over the years, they've learned doing those helps them feel relaxed and their anxiety is down. And what happens when they get cancer, somebody comes to help them. And they don't put their clothes in the right place. They put their underwear in the wrong drawer. They don't put the gowns in a separate drawer. And that more anxious because they're not controlling their environment. People that's not obsessive compulsive disorder, it's a mild form, but people that do these rituals by controlling their environment, that helps control their anxiety. Next. So how do you treat anxiety? You know how you feel when you're in pain, right? You can't sit still. You can't be comfortable because you're in pain. So get pain medicine. Anti-anxiety drugs can help. Antidepressants can also help with depression and anxiety. If you have allergies to different medicines, that can help. There's some medicines like Reglan, Compazine, and Phenagrin that can cause you to feel agitated and you can't sit down, you can't sleep. That's kind of like an allergy. You need to get off of that medicine and get on something else. That's why antihistamines can help with that. Sometimes antipsychotics can help you relax and they're not habit forming. Supportive psychotherapy is also very helpful, along with cognitive behavioral techniques. So those things help. When you talk about a problem and you talk about your anxiety, it seems to take some of the power out of it, right? Next, please. Next. So resources. Up, back there. Self-help. We talked about distraction, right? Find something to do. People seem to be quilting a lot these days. So go for that. Sewing. Organize your picture album. Anything like that that distracts you from what you're thinking about. Visual imagery. So when you close your eyes, think about something that you really like. Like lately, there have been a lot of pretty sunsets. I don't know if that's because of pollution or what. But try to look at something every day that you really enjoy. It may be just be going outside and looking at the flowers or looking at the yard, or it could be anything like that. Meditation. There's some people that meditate every day. They even get up early in the morning to have quiet time. And this can include prayer if you wish, but it's a very quiet time for you. relaxation exercises. The phones, the iPhones or any kind of the phones are wonderful because there's phone apps like Relax Melodies. Calm is another phone app. And these can help you with breathing exercises and help you feel calm. Relax Melodies, if you like to listen to rain, or some people like to listen to water or the beach, has different sounds. And these are free apps. So you might try those. Going to the library can be helpful, especially if your medical center or where you're being treated has a library for patients. Computer can be helpful, but I'm going to swarm you about computers. Sometimes you go to the computer, you have a symptom, and you go, and people come in and say, oh no, I've got such and such. I said, where did you find that out? Oh, on the computer, it says the computer may give you misinformation. So be sure and watch what website you go to. Next, please. On the computer, you also can find support groups. So Eleanor Roosevelt, this is very profound. Listen to this. You gain strength, courage, and confidence by every experience in which you stop to look fear in the face. You're able to say to yourself, I've lived through this horror. I can take the next thing that comes along. So you think about your cancer, and if you're through with your treatment, you live through treatment, and whatever happens next, you'll get through that too, if it happens. So it's important to build your support team. It can be your caregivers, family, friends, support groups, physicians and healthcare team, part of your support team, your spiritual support, psychosocial clinicians. This is all of your support team. Next. So think about it just for a minute. Who is your support team? You may be listening at this with a member of your support team, but look around. Some people have very, very few people in their support team. Other people have a lot. If you have a big support team, often what people do is have one person that people contact to find out how you're doing. And then you don't have to answer so many emails or so many Facebook posts. Next. So why do you need a support team? It makes you feel more secure, right? To know that people are rooting for you and helping you. You don't feel so isolated. You don't feel as vulnerable to depression. You get better information processing and management. Often I recommend that people take someone with them when they go see their doctor, because you each hear something different. Sometimes people even will record the session because they don't hear everything. They may hear a few things, and then when they get in the car, they talk to their person and they didn't hear the same thing. They compare notes. It provides you physical and logistical support. Sometimes you need a ride to treatment. You don't want to go by yourself again. And people who have a support team have an increased likelihood to successful coping. Next. So other resources, Cancer Counseling Inc., professional staff, private counseling can be helpful. Religious organizations have help. I know it's hard when you're a member of a very small church and you will really want to have, you're a private person. And I know people that don't tell their church members they have cancer, but then they can't be prayed for, can they? But that's their choice. It's always your choice to tell who you want to tell. The American Cancer Society provides a lot of support, as does the National Cancer Institute. So when you go to the computer, put in National Cancer Institute, and you can find out information about your cancer and what treatments are possible. Next. So John Wayne said that courage is being scared to death and saddling up anyway. Next. You're going backwards. Next. Okay. In Dune, back. Frank Herbert, and most of you read Dune or you saw the series or whatever, and he talks about fear. I must not fear. Fear is a mind killer. Fear is a little death that brings total obliteration. I will face my fear. I will permit it to pass over me and through me. And when it has gone past me, I will turn to see fear's path. Where the fear is gone, there'll be nothing. Only I will remain. So think about that sometimes when you're fearful. Think about letting it pass over you. Instead of ignoring it, like some kind of like pain, if you focus on that pain, let it pass through you. Let the fear pass through you, and then there you are. Do what you can right now. You can't choose to have recurrence, but you can choose how to control the fear of it, right? So I think that this fear is a robber. It steals away your good time. If you are in remission now, but you think, what if my cancer comes back? And what if this is cancer? Then if your cancer does come back in 5 years, you will have wasted those 5 years worrying about cancer, and you will live like you have it instead of being able to enjoy your remission. You know this. You can never go back to the way things were before your cancer. We never want to go backwards. You always want to go forward. You're a different person. You've learned things as a result of having cancer and living through it. So those things, what most people tell me, one of the things they learn is to be more compassionate to other people. So you can pay it forward, but live today. But what if I have cancer? What about if it comes back? Then you'll deal with it when it comes back. But right now, you know, your cancer is either being treated or you don't have it. It's been successfully treated. Next, please. So this is MD Anderson Cancer Center. You can see why 20,000 people work there. It's a big institution. So I wish all of you well, and I thank you for attending this webinar. If you have any questions, be sure and type them in, and Lee will help with that.
Thank you so much, Mary. We have a few questions. The first question is there ever a time where fear of reoccurrence can be helpful for a patient?
Can be hopeful.
Can be helpful.
The only time I can think of is you're so afraid you're going to get cancer back, it's going to come back, that you have a healthier living style. You eat healthier, you exercise. That would be the only thing. It would motivate you to have healthier lifestyle.
Thank you. This question comes from a spouse of a patient with MDS, and she says, my husband is dealing very well with his MDS and he's in remission. However, I am very fearful that his remission, he may end up with MDS again. Do you have any tips for caregivers in dealing with their fear that their loved one their disease may resurface?
Well, it would be the same as I mentioned for anybody, to focus on right now. He doesn't have cancer. He's in remission. So right now is your good time. If there's something you want to do, and I think the COVID-19 isolation has affected every single person in the world. And so if you thought, when he gets in remission and if he gets stronger, we're going to go on a vacation or we're going to take a trip. Well, you're not going to be able to do that for a while. But focus on what you can do together. And he's in remission. Yeah, but what if it comes back? Nope, you'll deal with it then. You couldn't plan for this, right? Nobody could plan to have cancer. I've worked 30 years at MD Anderson, and I couldn't plan to have cancer because you each deal with it in a different way. So you have to tell yourself right now, he's disease free, and we're going to enjoy it right now.
Oh, thank you. Um, it do for patients who are having a fear of reoccurrence, should they discuss this with their healthcare provider? Should they seek guidance from a social worker, or what's the best advice on who they should talk to regarding their fear of reoccurrence?
So I think that's a great question. The fear you have is not based on reality. It's your imagination. But if it's interfering with your life, I think it's very important to ask your healthcare provider if you can see the social worker or if you can see somebody in psychiatry to help you deal with your anxiety about this. Sorry.
That's okay. Thank you. How does someone know if they're just having a normal fear of reoccurrence, or they're maybe having some symptoms that need greater help, maybe potentially seeing a counselor? How does someone know when their fear is the normal fear that patients go through, or maybe their fear needs more professional assistance? Are there some symptoms that people
Well,
should look for?
thank you. That's a good question too. Can you hear me?
Yes.
Okay. I think that one of the things that happens as soon as the treatment's over, people do have fear. It's higher then because you're thinking, okay, treatment's over. Wonder when it's going to come back. But as your normal life comes in, you start feeling stronger. You're able to do more normal things for you. Then that goes away. It goes back. And every year when you get your checkup, you get more anxious. You think, why am I not sleeping? Then you realize, I'm having tests done next week. So those are very normal things. But if you find that you have this fear and you're preoccupied with it, then it would be helpful to see somebody. Now, I'm biased. I think everybody needs to see a therapist. I don't think it would hurt anybody to see a therapist. But and I realize you have to pay for it, insurance and all of that. But, it doesn't need to be a lifelong commitment. You could see somebody for 3 or 4 times, and it can help you, or even 1 or 2 times.
Well, thank you. This question comes from a patient with aplastic anemia, and he was treated with ATG and is doing extremely well. Counts are well. However, he does have some fear of reoccurrence, and he would like to know, how do I discuss with my family that I'm having some concerns about reoccurrence?
Well, I can tell you from my experience with patients that when they talk about the fear of the cancer coming back, the family will say, oh, you don't need to worry about that. It's not going to come back. You're going to be fine, because they don't want to hear it. So that's why I think it's so important to talk to a therapist, a social worker, or somebody in psychiatry, because they'll let you talk about your fear. It's very rare that families will let them talk about their fear because they don't want to hear it. They don't want them to be fearful. So they say everything's going to be fine. So there you are. Think, well, I can't talk to anybody about this, but you can.
Thank you. Is there, so for finding a therapist or a counselor, do you have some suggestions on how folks are able to do that, to make sure that they're finding somebody that's reputable and that would be able to help them with the specific concerns involving patients, whether they are through hematology or oncology?
That's an excellent question. And unfortunately, if you're in a smaller place, a smaller community, you might not have access to therapists who specialize in treating cancer patients. And that's a very, very small specialty because your fears are different from people who have a broken arm or heart trouble or something. They're different. You have different issues, because one of the things when you've been diagnosed with cancer, it's like living with chronic grief. The source of your grief, which is the cancer, which initially took away your health and made you doubt your future, is always with you. Even though you're in remission, it's time for that checkup, and there you go, you start grieving again. So you can look for a grief counselor. You can ask your doctor if there's anybody that they would suggest, or your healthcare provider. Sometimes if you're in a larger institution, then they have, like MD Anderson, we have special therapists, social worker, and psychiatrist. So that would be something. It is a very difficult thing. Also, you could call if there's a therapist, or look on your insurance first of all, and see who's on your insurance, and then just call the therapist and say, I have MDS or AA, and I would like to talk to somebody about my fears, and then talk to them what kind of therapy they do, and find out if this, or ask them how they deal with grieving, because this is about grieving. And you can interview them on the phone, and then you don't have to go in and waste 45 minutes telling them your life story and find out, oh, we're just not a fit. So, I think it's important to feel comfortable with who you see.
Thank you. Mary, do you have any last comments for those that are on the webinar? Any further tips or any other advice that you would like to give?
No, the main thing of all that all of us have to work on is staying in the present. You may have oh no, I have this symptom and what if my cancer's back? That's a momentary thought. But then you get over it, and then, okay, right now I know I don't have cancer. Right now, everything is fine. And focus on finding enjoyment every day. It doesn't mean you're jumping over the house because you're so happy. It just means finding enjoyment. You may want to go outside and look at the moon. It's coming down from a full moon. You may want to just look at the everything's green now. So find something you enjoy. It may be a television show. You can enjoy television and make you laugh or make you glad that's not your life. So find something to enjoy every day. It doesn't have to be a big thing, and it doesn't have to cost any money.
Well, thank you so much, Mary, for taking the time to share your expertise with us. And if you would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If we were not able to answer your question, please feel free to send it to us at any time in 3 ways. Send an email to help@aamds.org. Call our helpline at 800-747-2820, extension 2, or submit a question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us this evening, making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are here to support you and your family as we have for the past 36 years. This concludes today's program, and thank you for joining us.